The next exercise we're going to do is called the lift-off. The lift-off exercise is good for increasing strength in the subscapularis muscle. The subscapularis muscle provides an internal rotation moment for the shoulder, and this is what we're trying to increase the strength of. To do this exercise, you'll bring your hand by your side. This is the first step of the exercise. Keeping the elbow in a constant position, Lindsay will lift her hand up off the table and back down, engaging the shoulder blade muscles as she does this and not extending her elbow as she does the exercise. Go ahead and do a few good reps, just like this. Now without my help. To advance this exercise, you would place your hand on your back if you have the allowable range of motion to get there, and simply lift your hand up off your back, again maintaining the same amount of elbow range of motion during the exercise. In other words, do not extend your elbow as you lift your hand up off your back. Straight up off your back. Good. The next exercise we're going to do is called open chain proprioception. This is to engage the rotator cuff muscles and create some increased activity to promote stability and proprioception in the shoulder. To do this, if you have the active motion, you're in this phase of the rehabilitation. Lindsay, we're going to have you hold your arm up like this. Thumb remains up. To start, we can do something like have Lindsay do small circles with her shoulder. And you can increase the speed or the direction or the size of the circle. Try to go a little bit faster in a smaller circle. If you'd like to make this interesting, you could do what we call alphabets. You can draw the alphabet in space with a straight elbow, so you go A, B, C. Again, this promotes quick motion in the shoulder that changes direction constantly. Lindsay will have to create a lot of tone in her rotator cuff muscles to activate these motions and engage or initiate these motions. Now, to make it really interesting, what we have Lindsay do is you're going to hold your arm like this. I'm going to apply some resistance in different directions, and Lindsay's going to resist me. I can start down here to make the exercise easy. To make it more difficult, I'd go up toward her wrist. Okay, hold it steady, take a break. Now what I'll do is I'll just hit from different directions, not giving her any indication of where I'm going to hit from. As it becomes more difficult, I can do this. And Lindsay has to use her muscles a lot harder to hold her shoulder in a constant single position. To make it more difficult, we'll have Lindsay close her eyes. She won't expect the hit from each direction. This will make it extremely difficult for her to hold her shoulder in one position. Relax. So that's how we start off the proprioception of the exercise, increasing with more intensity. Again, be careful that this does not create any sharp pain in the shoulder or any type of impinging pain as you do this. If it does, just decrease the intensity or discontinue the exercise if need be. The next round of exercises we're going to do are called isometric exercises. These exercises mean that there's no lengthening or shortening of the muscle while you contract the muscle. To make these specific for the rotator cuff muscles, what we'll do is first place a towel under the elbow. For internal rotation, we hold against the front of the fist, contract for 10 seconds, ramp up for 2, hold for 6, and then ramp down. For external rotation, hold the wrist from the other side, pull your arm away from you, again ramp up for 2 seconds, hold for 6, and ramp down for 2. These exercises can also be done in a door, where we hold to the inside of a door jamb, pull in, hold for 10 seconds, relax. For external rotation, pull against the door, again 10 seconds. For a forward punch type exercise, we will push against the door as if we're trying to push the door away from us. Relax after 10. For a row type exercise, we'll pull against the door. Relax after 10. And for abduction or the deltoid muscle, we'll simply try to push our elbow against the door for 10 seconds, then relax. The next set of stretches are to increase motion after you've advanced to this stage of the rehabilitation. The first stretch we'll do is external rotation in a door jamb. So Lindsay, we'll have you step. Place your hand on a door. To increase the amount of external rotation of the shoulder, simply turn your body into the doorway while maintaining a position where the shoulder or the elbow is right against the side of your body. Hold the stretch for 30 to 60 seconds. After the 30 to 60 seconds, return to the start position. Go ahead and do that a few times. From this position, you can increase the abduction in your arm. Step out to the side. Bring your arm again into this 90-90 position, 90 degrees of abduction, 90 degrees of elbow flexion, and stretch through the doorway. This stretch provides a stretch onto the anterior portion of the shoulder. It should be avoided in overhead athletes with anterior instability. Hold the stretch for 30 to 60 seconds. From this position, you can abduct your arm a bit more, bringing the hand up to the top of the doorway or as high as you can go into forward elevation. Again, you're going to bring your body close to the doorway and stretch through it. If you have limited forward elevation, you can use this to increase the amount of forward elevation to achieve full forward elevation. Hold the stretch for 30 to 60 seconds and then relax. Try it a few times. And back. If you feel a pinchy feeling on the top of the shoulder, this probably means that you're impinging in the shoulder. Be careful of this pain and try to avoid it. It's okay if you have a mild sensation of this pinchy feeling during the stretch. If it is intense, decrease the angle of forward elevation and continue with the stretch until you don't feel the pinchy feeling on the top of the shoulder. This exercise is done to increase forward elevation while we're trying to promote some strength and scapular retraction, and again increase some strength between the shoulder blade muscles. To do this exercise, place a ball on the wall, hold your wrist against the ball while maintaining a force against the ball, roll the ball up the wall. To do this exercise, you'll have to engage the shoulder blade muscles behind the shoulder while you're elevating your arm up above your head. This stretch is called the internal rotation stretch. It's meant to increase the internal rotation of the shoulder. To do this stretch, use a towel rolled up and take one arm right on the back side, hold on to the towel. Take this arm to the top and slowly pull the hand up the length of the back. Bring your hand up until to the point where you achieve a stretch. Maintain this stretch for at least 30 to 60 seconds. For comfort, you can pull your hand over the shoulder and just relax the towel, just like that. Okay, again, start from the beginning. Bring the hand down. Pull the hand up. Hold the stretch.